painkiller fentanyl, the deadliest drug in the country.
The CDC reports that fentanyl is the deadliest drug in America. The rate of drug overdoses involving the synthetic opioid climbed by about 113%.
2 milligrams. That's about the size of a few grains of sand. It's barely visible to the naked eye.
This is actually 2 milligrams of fentanyl in a vial. You can see that it's sticking to the side. It's a bit of a residue.
You can almost can't even see it in there. It's such a small amount.
And it's enough to kill you. This is fentanyl, a synthetic opioid so potent, so deadly, that it has become the leading cause of death for Americans aged 18 to 45. Not car accidents, not gun violence, not cancer. Fentanyl. In 2023, fentanyl and other synthetic opioids killed 74,702 people in the United States. That's about 70% of all drug overdose deaths. In 2024, that number dropped to 48,422, a remarkable decline of 37%. But experts warn this might just be temporary, because in January 2025, deaths started rising again. The economic cost, a staggering $2.7 trillion in 2023 alone. That's 9.7% of America's entire GDP, lost to a single drug. But here's what most people don't know. This crisis has a source, a supply chain, and it starts in China.
China is accused of enabling the cartels by supplying the precursor chemicals that are needed to make fentanyl.
This is the story of how Chinese chemical companies, backed by government subsidies, flooded America with the deadliest drug ever made. How Mexican cartels turned those chemicals into pills, and how, despite everything, the fentanyl keeps coming. Fentanyl wasn't always a street drug. It started as a miracle. In 1960, a Belgian chemist named Paul Janssen synthesized fentanyl in a laboratory. It was designed as a powerful painkiller for surgery and cancer patients. It worked incredibly well, 100 times more potent than morphine. For decades, fentanyl remained in hospitals, administered by doctors under strict supervision. It saved countless lives. But in the 1990s, something changed in America. A company called Purdue Pharma, owned by the Sackler family, began aggressively marketing a drug called OxyContin. They told doctors it was safe, that addiction was rare. They lied. Between 1999 and 2017, prescription opioid deaths rose from 3,442 to 17,029 annually. Millions of Americans became addicted. When doctors finally started cutting back on prescriptions, addicts turned to the streets. They switched to heroin. But heroin was expensive, inconsistent, hard to smuggle in large quantities. Drug traffickers needed something more profitable, more potent, easier to transport. They found fentanyl. Here's why fentanyl is so appealing to traffickers. 1 kilogram of fentanyl can make 500,000 pills. Those same 500,000 pills would require 50 kilograms of heroin. Fentanyl is easier to smuggle, easier to produce, and insanely profitable. By the mid-2000s, illicit fentanyl began flooding American streets. It was mixed into heroin to make it stronger, pressed into fake prescription pills added to cocaine, even methamphetamine. Users didn't know they were taking fentanyl. Many of them died on their first try. Drug overdose deaths involving synthetic opioids, primarily fentanyl, rose from 3,105 in 2013 to 73,838 in 2022. A 24-fold increase in less than a decade. But where was all this fentanyl coming from? The answer lies in China. Specifically, in cities like Wuhan and Beijing, where chemical manufacturing companies openly advertise fentanyl precursors on the internet. Precursor chemicals are the ingredients needed to manufacture fentanyl, and China-based companies became the world's primary suppliers. In 2019, China officially banned the production of fentanyl. But here's the thing, they didn't ban the precursors. So these companies simply pivoted. They started selling the ingredients instead of the finished product, and business boomed. Let me give you some names. Real companies, real people. Hubei Aox Biotech Co. IT, based in Wuhan. For more than a decade, this company sold fentanyl precursors to customers throughout the United States. They advertised online and through social media platforms. From November 2016 to November 2023, Hubei Aox sold and imported 11 kilograms of fentanyl precursors to the US. That's enough to produce millions of fentanyl pills. How did they ship it? They falsely labeled the packages as furniture parts, vases, and makeup. In November 2023, U.S. authorities indicted Hubei Aox, its director Xuening Gao, and 3 senior employees. The Chinese Ministry of Public Security responded by dissolving the company and arresting 4 of the defendants. But Hubei Aox was just one company. There were many others. Guangzhou Tengyue Chemical Co.'s Limited. Even after being indicted in October 2024, the company continued operating. In early 2025, its sales representatives were still coordinating shipments of deadly chemicals to customers in the United States. In October 2024, the U.S. Justice Department unsealed indictments against 8 China-based chemical companies and 8 Chinese nationals companies like Hubei Shanglin Trading, Jiangsu Ji Chemical, Tianjin Furuntongda Tech, Wuhan Jinshang Import and Export, and Henan Umeng Trade. All of them were charged with trafficking fentanyl precursors. All of them used cryptocurrency, Bitcoin specifically, to hide their transactions. But here's the most shocking part. These companies weren't operating in secret. Many of them received government support. In April 2024, investigators for a U.S. House committee released a report detailing how the Chinese government directly subsidizes the manufacturing and export of illicit fentanyl precursors. Companies that make fentanyl precursors can apply for state tax rebates and other financial benefits after exporting the product. The Chinese Communist Party provides monetary grants and awards to companies openly trafficking illicit fentanyl materials. One investigative report found that a government prison actually owned and operated a chemical company called Yafeng, which served as a hub for Chinese firms selling fentanyl products to Americans. The report concluded, the fentanyl crisis has enriched the Chinese chemical industry, helped CCP-linked organized criminal groups become the world's premier money launderers, and has had a devastating impact on Americans. Those precursor chemicals from China don't go directly to American streets. They go to Mexico first, to the cartels. 2 organizations dominate the fentanyl trade: the Sinaloa Cartel and Cartel Jalisco Nueva Generación, CJNG. These aren't street gangs. They're sophisticated transnational criminal organizations with annual revenues in the billions of dollars. They have chemists, logistics experts, and vast distribution networks. When precursor chemicals arrive from China, shipped directly or routed through third countries, cartel chemists synthesize them into fentanyl in clandestine laboratories. These labs can produce thousands of pills per hour using industrial pill presses. Many of the presses are also sourced from China. Once produced, the fentanyl is pressed into pills designed to look like legitimate prescription medications. Fake Percocet, fake Xanax, fake Adderall. They're called pressed pills, or M30s. To a user, they look identical to real prescription drugs, but they contain fentanyl. And because fentanyl is so potent, even slight variations in dosage can be fatal. The DEA says that 4 out of every 10 fake pills seized contains a lethal dose of fentanyl. In 2024, the DEA seized more than 55 million fentanyl-laced fake prescription pills. That's down from 80 million in 2023, but it still represents more than 367 million deadly doses. How does it get into the United States? Most of it crosses the southwest border. In 2024, U.S. authorities seized about 21,100 pounds of fentanyl at the southern border with Mexico. By comparison, only 43 pounds were seized at the northern border with Canada. About 80% of all fentanyl seized in the United States comes through the southwest border region, and most of it is hidden in passenger vehicles, cars, trucks, SUVs driven by ordinary-looking people. The cartels recruit U.S. citizens and legal residents to drive the drugs across. These drivers are less likely to be searched. Many of them have no prior criminal record. Once inside the United States, the fentanyl is distributed through established drug trafficking networks. It reaches cities and towns across all 50 states. But the cartels aren't just trafficking fentanyl anymore. They've started adding other chemicals to make their products even more deadly. If fentanyl wasn't deadly enough, drug traffickers found ways to make it worse. In recent years, a veterinary tranquilizer called xylazine has been increasingly mixed into fentanyl. Xylazine is used to sedate large animals like horses and cattle. It's not approved for human use. On the street, it's called tranq, and it causes horrific damage. When xylazine is injected, it causes severe skin wounds that don't heal. Users develop large, festering ulcers that can require amputation. In Philadelphia, some emergency rooms report that 90% of drug samples now contain xylazine. But here's the real danger. Xylazine intensifies fentanyl's effects. It causes severe respiratory depression. And unlike opioid overdoses, xylazine overdoses don't respond well to naloxone, the overdose reversal medication. Hubei Aox, that Chinese company we mentioned earlier, sold 2 kilograms of xylazine to U.S. buyers between 2016 and 2023. And then there are nitazines, a class of synthetic opioids that can be even more potent than fentanyl. Some nitazines are up to 40 times stronger than fentanyl. A January 2024 DEA report warned that nitazines are being trafficked and abused for their opioid-like effects. They have a high potential for addiction and can cause respiratory arrest, leading to death. And guess where they're coming from? China. The same companies selling fentanyl precursors are now selling nitazines. In fact, nearly 70% of overdose deaths in 2023 involved multiple substances. Fentanyl mixed with xylazine, fentanyl mixed with cocaine, fentanyl mixed with methamphetamine. These polysubstance deaths are harder to treat and harder to prevent. Users don't know what they're taking. They just know they're chasing a high. Fentanyl has become more than a public health crisis. It's become a geopolitical weapon. In November 2023, President Joe Biden met with Chinese President Xi Jinping in California. One of the key outcomes was a promise from China to crack down on fentanyl precursor chemicals. Biden said, "We're taking action to significantly reduce the flow of precursor chemicals and pill presses from China to the Western Hemisphere. It's going to save lives, and I appreciate President Xi's commitment on this issue." For a while, it seemed to work. In late January 2024, a senior Biden administration official reported that the U.S. was starting to see reductions in seizures of precursors at some U.S. ports. China scheduled 3 additional fentanyl precursors. They resumed submitting suspicious shipment reports to international authorities. They even warned Chinese companies that they could face law enforcement action from other countries. But many experts remained skeptical. In March 2025, China released a white paper describing steps it had taken to control fentanyl-related substances. But critics said the paper obfuscated the nature of the problem, focusing on 2019 actions while ignoring the ongoing export of precursor chemicals and the subsidies, the tax rebates for exporting these chemicals. They continued. In February 2025, President Trump announced sweeping tariffs on Canada, China, and Mexico. He called fentanyl an extraordinary threat and cited the 3 countries' roles in illegal drug flows. The Trump administration claimed that fentanyl deaths range anywhere from 300,000 per year to tens of millions. These figures are wildly inaccurate. Law enforcement and public health experts say the actual number is around 50,000 to 75,000 annually. But there's a paradox here. By the time Trump took office in January 2025, the fentanyl crisis was already improving. Deaths had dropped 27% in 2024. Seizures were down. Cooperation with China had increased under Biden. After Trump announced tariffs, Mexico deployed 10,000 additional troops to the U.S. border. Mexican President Claudia Sheinbaum intensified law enforcement efforts, seizing thousands of kilograms of fentanyl and arresting more than 6,000 individuals linked to drug trafficking. But experts warn that tariffs alone won't solve the problem. As one researcher put it, fentanyl precursor chemicals are relatively easy to produce and widely available. Controlling every compound that can produce a version of fentanyl is like putting toothpaste back in the tube. At the DEA headquarters in Arlington, Virginia, there's a wall called The Faces of Fentanyl. It displays photos of Americans who died from fentanyl overdoses. Young people, old people, mothers, fathers, children. Each photo represents a life cut short, a family destroyed, a future erased. For Americans aged 18 to 45, fentanyl is now the leading cause of death. Not car accidents, not gun violence, not cancer, fentanyl. Many victims never intended to take fentanyl. They thought they were taking Percocet for back pain, or Xanax for anxiety, or Adderall to study. They had no idea the pill was fake. The DEA has launched a campaign called One Pill Can Kill, because that's the reality. With fentanyl, there are no second chances. There's no learning from your mistake. One pill can be your last. But there is hope. It comes in the form of a medication called naloxone, commonly known by the brand name Narcan. Naloxone is an opioid antagonist. It reverses the effects of opioid overdoses within minutes. In September 2023, it became available over the counter in the United States. Anyone can buy it at a pharmacy. Since naloxone became widely available, countless lives have been saved. EMTs, police officers, family members, even bystanders have administered naloxone and brought people back from the brink of death. Some cities have installed naloxone vending machines. Schools train students how to use it. Harm reduction organizations distribute it for free. But naloxone is not a cure. It's a temporary fix. Someone who overdoses once is at extremely high risk of overdosing again. True recovery requires comprehensive treatment, support, and time. And treatment programs are overwhelmed. Waiting lists stretch for months. Many people who want help can't access it quickly enough. The economic burden is crushing. In 2023, the fentanyl crisis cost the United States an estimated $2.7 trillion. That's 9.7% of the entire GDP. Of that total, $1.1 trillion is attributed to deaths, another $1.34 trillion to lost quality of life, and $277 billion to healthcare, reduced labor productivity, and crime-related expenses. But numbers can't capture the full scope of the tragedy. The mothers who will never see their sons graduate, the children who will grow up without parents, the dreams that will never be realized. After years of relentless increase, something remarkable happened in 2024. Fentanyl deaths dropped from 110,037 total drug overdose deaths in 2023. The number fell to 80,391 in 2024. That's a 27% decrease, the lowest level since 2019. Deaths involving fentanyl specifically dropped even more dramatically, from 76,282 in 2023 to 48,422 in 2024, a 37% decline. What happened? How did a crisis that seemed unstoppable suddenly reverse course? Experts point to several factors working together. First, naloxone became widely available. Over-the-counter Narcan meant that more people could access it quickly. Emergency responders, family members, and even users themselves could administer it. Second, access to addiction treatment improved. The Biden administration invested billions in treatment programs, harm reduction services, and recovery support. Medicaid coverage expanded to include more treatment options. Third, law enforcement efforts intensified. The U.S. worked with China and Mexico to disrupt supply chains. More precursor chemical seizures, more cartel arrests, more cooperation between countries. Fourth, and this is interesting, the fentanyl on the street may have gotten weaker. Some researchers who sampled the drug supply found that in 2024, street fentanyl was less potent than in previous years. This could be due to supply chain disruptions or changes in production methods. And fifth, behavioral changes. After years of watching friends die, many drug users became more cautious. They tested their drugs. They used smaller doses. They didn't use alone. The decline saved thousands of lives. about 81 lives per day according to CDC estimates. But here's the problem. It might not last. In January 2025, overdose deaths started rising again. The 12-month period ending in January 2025 showed 82,138 deaths, an increase of about 1,400 from December 2024. Keith Humphreys, a researcher at Stanford University, warned, if we assume it's not a blip, this makes it more likely that the sudden drop was a one-off event rather than a fundamental change in epidemic dynamics. In other words, the crisis might not be over, it might just be pausing. So what now? Can the fentanyl crisis be stopped? The honest answer is, not easily. Fentanyl is too profitable, too easy to produce, too potent. As long as there's demand, there will be supply. But that doesn't mean we're helpless. The 2024 decline proves that coordinated action works. Here's what needs to happen. First, sustained pressure on China. Not just tariffs or rhetoric, but actual enforcement. Chinese companies that export fentanyl precursors need to face real consequences. The subsidies and tax rebates need to end. International cooperation needs to continue. Second, disrupting the Mexican cartels. This isn't just about border security. It's about targeting the money, the supply chains, the pill presses, the chemists. It requires cooperation between the US and Mexican governments. Cooperation that has improved, but remains fragile. Third, expanding access to naloxone. Every school, every workplace, every public place should have naloxone available. It should be as common as fire extinguishers. Fourth, investing in treatment, not just emergency response, but long-term recovery programs. Medication-assisted treatment, mental health services, job training, housing support. Recovery is possible, but it requires resources. Fifth, prevention and education, especially for young people. The "one pill can kill" message needs to reach everyone. Fake pills look identical to real ones. Testing strips that detect fentanyl should be widely available. But here's the uncomfortable truth. Enforcement alone will never solve this. As long as millions of Americans are struggling with addiction, there will be a market for fentanyl. The opioid crisis didn't start with fentanyl. It started with prescription pills, with Purdue Pharma telling doctors that OxyContin was safe, with pharmaceutical companies prioritizing profits over lives. It continued with a lack of mental health services, economic despair, and a healthcare system that treats addiction as a moral failing rather than a disease. Fentanyl is a symptom of deeper problems, problems that can't be solved with tariffs or border walls alone. Let's go back to where we started. 2 milligrams, the size of a few grains of sand. That's all it takes to kill someone. And in 2023, it killed 74,702 Americans. In 2024, that number dropped to 48,422. But in early 2025, it started rising again. This crisis has a clear supply chain. Chinese chemical companies, some of them receiving government subsidies, manufacture and export fentanyl precursors. Mexican cartels synthesize those chemicals into fentanyl and press them into fake pills. Those pills cross the US border, hidden in passenger vehicles, and they end up on American streets, in American homes, killing Americans. The economic cost is staggering, $2.7 trillion in 2023. That's nearly 10% of America's GDP, but the human cost is incalculable. Every photo on the Faces of Fentanyl wall represents a life that mattered, a person who was loved, a future that was stolen. So who is responsible? The Chinese companies that knowingly sold deadly chemicals? Yes. The Chinese government that subsidized those exports? Yes. The Mexican cartels that turned those chemicals into pills? Yes. The pharmaceutical companies that created the opioid epidemic in the first place? Absolutely. The US healthcare system that failed to treat addiction as a disease? Yes. The answer is all of them. This is a systemic failure on a global scale. But there is hope. The 2024 decline proves that when naloxone is widely available, when treatment is accessible, when law enforcement cooperates across borders, when people change their behavior, lives can be saved. 30,000 fewer deaths in 2024 compared to 2023. That's 30,000 people who got a second chance. 30,000 families that weren't destroyed. Recovery is possible. Prevention is possible, but it requires sustained effort, resources, and political will. The fentanyl crisis didn't happen overnight, and it won't be solved overnight. But every life saved matters. Every person who gets treatment matters. Every naloxone kit distributed matters, because somewhere in America right now, someone is about to take a pill they think is safe, and it might contain fentanyl, 2 milligrams. That's all it takes. But it doesn't have to be this way. If you found this investigation valuable, please subscribe to Daily Junkie for more in-depth documentaries about the stories that shape our world.